In the UK, weight management is now quite structured. We have a framework of interventions that should all work together as you move up that framework and down that framework, with an increasing degree of complexity of the interventions that are available. Tier 1 is a population level intervention or primary activity. So this includes population level interventions such as the Change for Health programme or local variations of that might be being done by your local commissioners in local authority. But it also includes that primary activity that's done in primary care, identifying those patients who are overweight or obese by encouraging them to get weighed and measured, and identifying those who are at risk of healthy weight and working out what type of intervention they might need to help them get back to a healthy weight. Tier 2 is the next stage. That's community weight management levels, and it's at a population level, and it might be commissioned by your local authority and might be delivered by a commercial sector such as Weight Watchers, Slimming World or many others, or it might be delivered by your local dietetics and will have gone out to tender, but it's normally classroom based, it's normally time limited to 10 or 12 weeks, and it's a weekly educational programme to educate patients about weight loss, nutrition, exercise and the benefits of it. For those patients who don't manage to get back to a healthy weight or are already either clinically obese or have the medical complications of obesity, they might need a more specialist intervention, and this is what Tier 3 is. Tier 3 is your specialist weight management centre that has a multidisciplinary team approach that might have specialist nurses and specialist healthcare assistants. It might have a GP with a specialist interest in obesity for prescribing weight loss medications or assessing them as to whether they need to go on for weight loss surgery. But it should also include some form of advice for physical activity, and some actually have on-site gyms where exercise therapists can actually do tailored physical activity programs for individuals. These Tier 3 services should also have what's called talking therapists, which is the psychology aspect as to why many people eat when you're not really hungry, whether it's comfort eating or habit eating, and we need to break those habits for any weight loss intervention to be successful. And obviously included in that Tier 3 service is obviously the dietetics input to make sure that we're also, as well as losing weight, we're eating healthily with a nutritionally balanced diet. And so it's a one-stop shop with all different NHS approved and evidence-based interventions to help with weight loss. If all of that medical management isn't successful and the patients either don't lose weight or are already at a more severe and complex level of obesity where they've got many medical problems and need more rapid weight loss, we might consider the introduction of a very low calorie diet, as low as less than 800 calories, but it's formulated to be nutritionally balanced, and that could be in that Tier 3 setting. Or we might consider a referral to Tier 4, which is bariatric surgery, where patients are referred on to another specialist multidisciplinary team specifically geared up to providing help and advice about introducing weight loss surgery for that patient. But it's important that during the Tier 3 phase that we actually identify those patients who would benefit most from it.